Hi, guys. My name is Joseph R. Pagano. I'm a senior at California University, PA. It's my pleasure to come and tell you guys about this project, this research project that my mentor, Dr. Block, and myself has put together. We're about to do data analysis on the satisfaction of telehealth services and behavioral health. And the population we're concentrating on is persons suffering with SUD, substance use disorder, right? At the Center of Excellence, which is a part of Southwestern Pennsylvania Human Services, which is SPHS. So we're concentrating on that population, and this project will entail a demographics and a satisfaction survey that will try to prove the efficacy of telehealth. This is a poster that I made, and I want to just tell you about who I am and what this is about and why we're doing it. Myself, like I said, is I currently also work at SPHS, so this is something the field of substance use disorder is something I'm very passionate about and I really believe in. So I'm a social work student. I graduated May of 21 with my BSW under Dr. Block. And, we wanted to do something that could truly, help with the impact of this viable service that has now been implemented in our country because of the current conditions of the COVID-19 pandemic. As you see, the introduction, it talks about what this year, I mean, what 2020 has brought to us. It's just a significant change in our country from this pandemic. Being a student here and working in this field, like I talked about, telehealth has just been this tool that has been this unknown tool that has been not utilized much, in especially in terms of an emergency situation, in healthcare. I've wondered, is this viable? Is this something that the efficacy, does it really work? Does it something that holds weight with patient care? The effectiveness, does it really substitute for face-to-face in-person treatment? Those are some of the questions forming my hypothesis for this research project. So as I approached Dr. Block, I wanted to work under her to expand my knowledge with her work, and we proposed a research project that would just research this quality and the satisfaction of telehealth. We compared it to the pre-pandemic face-to-face treatment, behavioral health therapy. The broader question, if I had one, it would be, how does this modality, um, in which someone accesses telehealth, impact their perception of satisfaction with those services? That's something I wanted to know. So we started this research project because why? Because COVID-19 causes a need. The need was there. Face-to-face services were dwindling. Um, many healthcare services have been changed. Federal, state policies have changed. Various health policies, they were affected by this telehealth. It is assimilated into our network of healthcare, into a viable source that was, uh, uh, a modality that now we had at our arsenal, be able to use this for patient care. These developments have been executed for the term of the pandemic. It's really unclear what policies are going to stay and what are not. So I think this research is going to show this effectiveness. Is it equitable? Is it effective? What is the efficacy of telehealth compared? So these are just questions and that I wondered, and I'm trying to prove. Therefore, in the middle of the shifting policies of during the pandemic, behavioral health providers just need decisions, whether their applications fade of utilizing this telehealth. Is it here to stay? Is it not? I did a literature review, and I succinctly examined the research that was done already for telehealth while this COVID-19 pandemic was happening. The review that I did, it shows the efficacy and effectiveness of this current modality of healthcare. So, some of the headings that we're talking about, some of the literature was in support, some was in opposition. Some of it said we support telehealth, but there should be some modifications. It needs changed, because there's so many. Some persons just aren't right for it. Some are. So these were questions that all came up through literature review. I talked about the research that was in support of telehealth. It showed the ways that telehealth benefited through specific populations. COVID-19, I mean, healthcare, changed all this, incorporated this, and it looked for like something in positive satisfaction in terms of continuity of care. So, using technology that previously existed, quicker examinations, treatments, some of the positive outcomes, or the positive, even the barriers uh, that affected treatment as a whole were, patients didn't want to stick around in a waiting room, wait for their to get called hours. Patients that lived in rural populations could not travel. I mean, they already couldn't travel because of their limitations they had already, and now you have COVID-19, where providers completely closed, and now you have this treatment modality. It's completely brand new, and I had to look at like what were the barriers now, and what were the pros, what were the cons, and that's where some of the things I looked at. It's a massive pro of this modality is that a patient can bypass this wait and meet a practitioner with little or no delay right at their residence, and that was something that just wasn't utilized before. The pandemic it's given us this avenue, to where we can go down, and this modality was able to be used, um, so that, in the world more than ever today. Telehealth is vital. It guarantees access to healthcare for people with physical limitations like diabetes, and it was utilized, and a lot of the literature pointed to that, where they it helped people overcome those barriers with with limitations in their daily life. Um, so, also a big part of this, some was persons that were in support, but they needed some modifications. They talked about studies that stated that telehealth was significant. They needed to consider questioning their services to ensure consistent quality of care, and that was a lot of the literature pointed to that, where they just wanted consistency in this, some consistency, satisfaction of services, not just something that was there, not something that could be used, but something that can be used efficient and equitably among all the populations. And but these modifications needed to be done. You had older individuals where their modality of telehealth, whether it was laptop, phone, uh, some of that prevented and caused barriers within the modality. So there was a lot to look at, and their visual acuity, social indications of education, internet's trust, mental understanding, hand-eye coordination. There were so many to name barriers within the modality that I needed to look at through this research. The barriers with telehealth with persons with disabilities, mental disorders. There was a lot of stuff that could prevent someone to, have them just prefer also, like, face to face interaction instead of the telehealth. So there was a lot of things where the modifications, who's it good for, who's not, and these were all things Dr. Block and I had to look at. The last section, it talks about just future directions for this. Overall research shows the world is focused. We're in the time, we're still in the pandemic. It's still going on. Telehealth is still going on. The world focuses on the way that, everything needs to be efficient. Everything needs to be, equitable in amongst the different populations, and how we engage clients. At the same time, we need to preserve their quality of care, and that's hard, and that's something to have the all work hand in hand. That's something I'm trying to prove in this research. Is it a viable method of care? Is telehealth here for good, or is it just something an emergency? Is it not? COVID-19, though some research has proven to be a curse, has brought this unknown modality of healthcare to the really forefront of our country. It's really brought to the forefront of our families and into our living rooms. Where we could see a doctor from and don't even have to get up out of bed. So, these are some of the things that Dr. Block and I looked at, and even though I didn't, I'm just starting the data analysis. The literature review is done. I am eager to move on with this and prove this efficacy. It's if it, what is it? Is it here to stay? The future direction of healthcare. Accompanied alterations of its modalities of treatment, including uh, supplementary training, can enhance this method of telehealth. That has come to be the chosen method of many providers, as the literature points to. So, whether it's here to stay, hopefully our research can prove that. Either way. So, thank you so much for this time. It is an honor to do anything, especially in human services. I am grateful and thank you so much, and have a wonderful day. Thank you. Be safe.